versus you. It's you 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 versus you. Time to clear your mental, everything you've been through. Looking in the mirror like you're the one with the issues. You against yourself, feel like you against the world. Internally battling all of the trauma.
Hey, what's up, everybody? I'm Saquon. I'd like to welcome you all back to the You versus You podcast. This is episode 14 of the podcast. We're going to have a great conversation today. We're going to talk about holistic health. We're going to compare and contrast that a little bit with conventional health and medicine. But specifically, primarily, we're going to talk about hydration therapy. I actually had the pleasure of having this treatment done twice now within a 2-week time span. And I feel amazing. And when I met this young lady, when she first came, I was initially apprehensive, as I think all men are, black men are, like we don't want to do anything health, right? So I'm good, don't do anything, don't touch me, right? But this lady had a healing aura, a healing presence about her. And I immediately felt super duper comfortable, safe. I actually mentioned that to her. And at that moment, I just let my entire guard down and I just received what I believed to be the fullness of the treatment that was administered. And afterwards, I felt amazing. This young lady, her name is actually Queen, and it's appropriately titled because she's the queen of hydration therapy. So with that being said, I'd like to welcome to the show Miss Queen Langlois.
Thank you.
Welcome
you
to
for
the
having
show.
me. Thank you.
Absolutely. Man, like I was just saying a moment ago, that treatment, like it really opened my eyes, right? And there's a lot that I want to say, but before I do, if you could just give us a brief introduction to hydration IV therapy and how you got into it, just tell us a little bit about your story. We'd greatly appreciate it.
Okay. As Saquon said, my name is Queen Langlois. I've been in this healthcare field now for over 21 years. I've been doing this for as long as I can remember, so it's just second nature as to helping people in that aspect. I got into IV hydration recently, about 5 or 6 years ago. I overwent health challenges myself. You know, they always say you don't know about anything until you go through things yourself. So with me going through thyroid problems or thyroid storm, as I found out during that time, what I was dealing with, a lot of my emotions, my energy, everything changed. It affected every organ in my body. And I went from taking no medicine at all to taking 10 pills a day.
Wow.
So it really changed my life. So I look at other methods of what I can do to help myself. And I ran across IV vitamin therapy. And I said, people need to know about this. I started getting my energy back. My anxiety level was down. I was able to manage my thyroid, where to have surgery and just get it totally removed. And from there down to just 1 pill a day, which is actually a hormone that I use for my thyroid. And I think getting to that point, the IV hydration and therapy helped me. And so letting others know about it, I said, I need to let the people know about this. All we know is medicine, but what about other things we can do to help our body? So that's what I aim to do. And I started doing this 5 years ago, ever since then.
That's phenomenal. And again, it certainly, again, in 2 weeks, had a profound impact on me. I am so thankful for having met you and that benefit that you've added to my life. Now, you and I were talking a little bit during the administration, and you were telling me about conventional vitamin consumption. Like when you do it the normal way, you get, what is it, 25%?
20, maybe 30% absorption of the actual vitamin or supplement that you're taking by mouth. And primarily that comes from, I say we like the middleman. Okay, our digestive system is the middleman because it has to go down and it has to digest and then go to the bloodstream. So by the time it gets to our bloodstream, we're looking at 20 to 30% of absorption in the body. Now, if you're someone who have digestive problems, then you may not even get 20 to 30% of the absorption of the vitamin. So when you're taking it intravenously, IV route, then it bypasses the middleman, which is the GI tract, and it just goes straight to your bloodstream.
And when you do that, you were telling me like this is like a full-on cellular cleanse. Is that correct?
That's correct. So when we talk about our bloodstream, what is the bloodstream? blood vessels, our veins, arteries, and capillaries, right? Makes up the bloodstream. But where does that go? Our bloodstream goes to our cardiovascular system. Our cardiovascular system is confused of veins and arteries going all throughout the body, from the heart to other organs. That makes up the circulatory system. So from the circulatory system, it goes from our head to our toes. That's why during your IV, I say you may feel it. Some people actually feel the fluids going in, and you can feel it to their feet and head because it's going through your circulatory system, which then give it a nice flush. We're flushing out all the toxins, and we want to replenish with the vitamins and the nutrients and the essential minerals that our body needs.
Awesome. Man. And actually, I wanted to ask you something that was very important. I lost my train of thought, but I'll come back to it. Okay, so the beginning, when you got there, I was initially mad at you, right? I felt I was healed, right? Like I felt like I'm in the presence of a healer. I felt comfortable, and then you stuck me, and it hurt, and I got mad, and I wanted to write you up, but I couldn't because you don't work for me, right?
Right.
But I got over it. But no, so 100% consumption of the vitamin via the intravenous way versus the regular digestive consumption.
Right.
Man, that's amazing. Now, you told me that this practice has been around since the early 1900s.
Yes.
And I didn't know anything about this.
Yes, so it started out in early 1900s with a doctor named Dr. John Myers. And that's where the Myers cocktail comes from. A lot of people know of the Myers cocktail. It's the most popular IV vitamin therapy. And Dr. Myers began with knowing that fluids alone can heal the body. So not necessarily medicine, right? Just rehydrating. Sometimes we're dehydrated and we don't know that we're dehydrated. And sometimes just hydration alone with electrolytes can help heal. I remember when I first started nursing, working in the ER, the first thing we had to do was start an IV, because fluids. Sometimes some people just need fluids, and that'll correct the problem, and they don't need further treatment. It kind of got away over the years with just starting the IV. But I remember early on in my nursing career, I used to wonder, why would he come in with leg pain? Why we need to start an IV? Get him fluid started. And I remember the doctor saying, just get him some fluid started, start an IV. Because sometimes we just need to replenish with just hydration and electrolytes.
Gotcha. And I felt like I had to take a little bit of my own medicine, because a prior episode, I was talking to a gentleman, I believe it was Renault. Shout out to Renault. We were talking about life systems and overall health. And I actually said that the majority of humans are walking around severely dehydrated and don't even know it.
Don't know
And with my mental health journey and now my physical health journey, I thought I was actually consuming enough water. But when you plugged me up, and I actually didn't know this, so how fast the IV drips is a direct indicator of how dehydrated you are.
Yes,
Is that
so
correct?
that lets me know how hydrated or dehydrated you are based off of the drip chamber. So I always look at the drip chamber. It lets me know if it's dripping really fast, that means your body is trying to eat it up, right? You're dehydrated. But if it's going at a steady rate, meaning that you're fairly hydrated, you just need your essential vitamins and nutrients. So that's how I can indicate whether you're dehydrated or hydrated enough during your session.
Now, yeah, when you plugged me up, mine was like a steady stream. It was like I was using the bathroom or something. It was that steady.
Thirsty.
I was that thirsty, right?
Yes.
Yeah, and you actually had to slow it down. And when you did, it was still a steady stream.
Yeah.
Right? So in that state, was I running the risk of anything? Like just,
No,
no? I was
risk.
just super duper dehydrated.
Just dehydrated.
Okay, that's very interesting because, I just bought the Aura Ring. So, I've said this in a couple of episodes. I don't want to just beat a dead horse, but I really think that it's important to quantify the things that we do, right?
Yeah.
Especially when it comes to our health and wellness, like really drill down into the numbers, extrapolate as much as you can, and understand it from a quantitative realm so that you can look at it, study, know where you need to make certain tweaks, adjustments, monitor it for a little while. And if that change works, great. If it's yielding results, if it isn't, then make another tweak, so on and so forth. But I say that to say this tweak, if you will, was amazing for me because like I feel like I have a strong mind. So I get up, I get after it, I work hard, I get up at 5 a.m., I go train, I do all of these things, right? And if I'm being honest, there are times, a lot of times when I still feel lethargic, right? But I still push through. Now, it's funny because I always like I feel that there's energy latent within me. Like I
Yeah.
feel like there's another gear that I can tap into. And I was like asking myself, like, yo, is this pride? Is this ego? Right? But I always like I felt that way inherently, like, yo, there's another gear inside of me. But that first time we got together and you gave me what you said my body needed, like I felt like I tapped into that gear. Like I felt like I was seeing in HD. I felt like I was
I
like
think I mentioned that
you
to
did.
you.
That's where I got that from. I stole it.
Yeah, you
And I
stealing
don't
my
feel
word.
bad about stealing it.
Yes, I say it kind of felt you couldn't describe the word. You know what you were feeling. But
Right.
I've been doing this long enough because I get them. I give it to my whole family, so I know exactly what you meant when I feel something. I don't know what. You feel like you're in HD. You feel like you're open. Your eyes open. Your pineal gland is open. Everything is open. So I think you felt that. And when I just said that, you were like, that's the word. I feel like everything is in HD, is clear.
Yeah. Like I went to work after that and my supervisor had given notice. So that was her last day. So we all went to lunch, but they immediately noticed a change in me. Like I'm always on 10 anyway, especially when it comes to work. I have to motivate, do things like that. But this was like a different level of 10. Like they thought I was on drugs or something. And I was telling literally everybody that I came in contact with at the restaurant, yo, hydration, IV therapy, you need it in your life. I'm sure they almost called the cops on me, but that's how adamant I was about it. And that's how good I felt. Now, fast forward to this past Friday, I felt really, really good. But I didn't feel as good as I did the last time. But I remember you mentioning that in addition to giving your body what it's needing, it's also fighting those free radicals, right? In addition to that, I think I was on day 9 continuously of a workout. So my body was about to crash and it needed rest. So my muscle fatigue in conjunction with it fighting those free radicals is what I felt like I was feeling. So I had like a little bit of a headache. I didn't experience cognitive dissonance. I was still alert. I still had energy to do what I needed to do, but I felt like I'm not my optimum self. Can you talk a little bit about that?
Yes. So with the second, and that's good you mentioned that because we talk about mixing the cocktails, right? Talking with you, what are we aiming towards? What is your goal for this IV hydration therapy? And for your second one, remember we talked about you being more inflamed.
Yes.
So giving you something more for anti-inflammatory versus giving you recovery like we did for the first IV, recovery and energy. So those different essential vitamins that I'm mixing in, it makes a difference. So that was the difference that you felt. It's fighting more because you were more inflamed. So your body is fighting more. It has more to fight against. So that's why the difference of the IV therapies, because you receive different vitamins within your cocktail.
And that's actually a perfect segue. So if you would please, Queen, if you can just list the different types of IVs that you give and then just sort of get as granular as you want with each of those so that the viewership can get as much insight as possible.
Yes, so starting with the most popular, known as the Myers cocktail, known as the Liquid Gold. I look at that as the overall wellness cocktail. It has everything in it: vitamin C, B12, B complex, calcium, zinc. It focuses more on our everyday, our fatigue. You want your energy, immunity. If you're someone who have chronic pain, it focuses on pain. So it's the overall go-to cocktail. If someone comes to me and say, I want to try this, but I don't know what I want, they're confused. Usually the Myers cocktail is the cocktail of choice because it focuses on everything, And then we have our immunity boost that focuses more on our immunity. So high doses of vitamin C, glutathione, zinc, and B complex. Those vitamins combined helps to, if you're coming down with something or if you're traveling and you want to boost your immune system so that you can have a high immune system, that way it combats any infection. So you are less likely to get sick with the immunity boost. And then we have our athlete recovery, which you had for your first session. The athlete recovery, it helps with performance and endurance. So lots of amino acids to help with that protein metabolism, zinc and magnesium to help with the recovery, muscle recovery and relaxation. And also vitamin C helps with healing as well. And B12 with energy, and B complex also with energy, and it helps with nervous pain as well. So focusing on the athlete recovery is really good for those who work out a lot, runners, those that have football players and basketball players, so the athlete recovery is really good for that. And then we also have our beauty. We have to talk about beauty. Beauty industry is so huge, but we also have the Inner Glow IV that helps with quenching the beauty inside out. Okay, it helps to diminish wrinkles, acne. It helps to brighten the skin. So that's combined with vitamin C, glutathione, and B complex together. It helps with skin. Okay, and we know the skin is the largest organ in the body, and we don't think of that, but skin is the largest organ in the body, and what you put on your skin does matter. So you need to protect your skin as well as any other organ internally. And also mixed with the glutathione and biotin. Biotin helps to strengthen hair, skin, and nails. A lot of the older population, not just for cosmetic, but older population gets alopecia, hair loss. So a lot of them want the biotin to help thicken their skin and thicken their hair follicles and grow their hair back. It's really good for those who are suffering from alopecia. And then we also have the operative IV. I would suggest pre-op and post-op. If you're going in for surgery, it's better to, I said, heal the body before going through the trauma. Anytime you go through any surgery, it doesn't matter how minor or how major your body is going to go through surgery, it's going to go through trauma. So we start to heal the trauma before the trauma. And that's what the preoperative IV focuses on, just healing your body before going through surgery. And then, of course, the post-op, it helps with recovering after surgery, healing, wound healing. And it helps to also increase the immunity because after surgery, our immune system is compromised, right? Going through anesthesia or just going through trauma with the body, it can suppress our immune system as well. So just to increase our immunity. So those are just some of the IVs that we offer that are major cocktails, right? But as you see, I like to individualize cocktails as well, just depending on what the client or the individual is going through or what their goals are. I call myself a little mixologist, right? Mixing vitamins and minerals together. So I like to customize IVs as well. So you don't have to get the preset, as I just named, IVs, but we can also individualize based off of your needs and what you're going through.
Awesome. And after a treatment, how long do those effects typically last?
Well, typically out 7 to 21 days, as the study says, but depending on that person. So if you're someone who is super depleted, you don't drink your water, you don't take your vitamins, or not doing all the things that your body needs for its essential vitamins and nutrients, it may be 7 days, or less. But if you're someone who's trying to do right, you're starting this healthcare journey and your wellness journey, and you're watching what you're eating, right? You're drinking your water, you're taking in fluids, then it typically is 21 days. Most of my clients have a monthly regimen where they just get their IVs once a month because it can last them for that time frame, just once a month.
Gotcha. Now, I think I mentioned on the outset, I didn't really know much about hydration IV therapy, but I remember watching some shows, right? And I would see people dripped up on IVs, usually after a night of huge debauchery or something crazy, some crazy shit like that, right? But yeah, like there are actually people that do that, right? And then they're replenished on the spot, so to speak, right?
So yes, I'm glad you said that because one of the IVs, which I don't have as much anymore, but it's the hangover IV. So if you do have that wild night right? You haven't drunk in a while and you went out and hung out with some friends and now you have a hangover the next day. So it replenishes on the spot. So the headache, the feeling of nausea will go away instantly when you get your hangover IV hydration.
Got you. I just hooked y'all up. So all y'all that like to go out and burn the midnight oil, this is what you need to do. Holla at Queen. Thank me later. You know, it's interesting because, I watch a lot of podcasts and I watch Joe Rogan. I want to segue a little bit
Okay.
and kind of compare and contrast a little bit, holistic health versus conventional health, right? And he said something, and I agree with it, right? Like, I'm not really a huge proponent of traditional medicine, right? And I know a lot of Black men aren't like that, right? A lot of it is fear associated, and maybe that's in me as well, right? So I don't want to be remiss and leave that out. But he did mention something that, again, stuck with me, and I believe I agree with this. If I fall, I break my leg, right, or if I break my arm, or even now because I'm quantifying my health journey, among other things. So for preventative measures, I will go for that as well. But anything else, I don't really want to go to a doctor, right? Like I want to seek holistic alternatives, right? Natural alternatives, things such as hydration, IV therapy that actually make me feel better on the spot. When you're explaining these things to me, you're saying, okay, you have this problem, this problem, this problem. I'm going to give you this, this, and this right now, and this is going to deal with that. As opposed to, I go here, I pay you $1,500. We don't quite know what you got, but you're going to try this, try this, try this.
Yeah.
Come see me back in 2 weeks.
Yeah.
Right? So I don't want you to bash the conventional medicine industry, but like, what are some of your thoughts on that?
I mean, no, I totally agree with you.
Okay, good. So we can do that. Good. My mother says I curse too much literally before this episode. So I'm going to try not to curse, but I am going to do that.
I know I do agree with you 100%. For certain things we know, okay, we have to go to the doctor for those things, right?
Right.
But as far as participating in medicine, we don't have to do that. So it's other things, naturopathic and holistic route, like now what we can do, right? So doing those things, I think let me back up. In the medical field, for instance, my own experience, right? Prior to 2019, all I knew was medicine, okay? I was taught to give this patient their prescription and blah, blah, blah. In the back of my head, I used to like, this patient doesn't need another blood pressure, but I'm not in a place where I can make that. I'm just a nurse. I have to follow orders, right? So when I started with the holistic routes, I noticed that all this time, I know I wasn't crazy. It's other things that we can do naturally that can heal the same things and such as medicine supposedly do, right? And learning that, it changed my life and my family life. I've even my clients, a lot of them started off on blood pressure medicine. And I have a handful of clients now can tell you that they don't have to take their blood pressure medicine, right? Because not only IV hydration, but once we establish a relationship, I'm here to help you. This is why I'm here. It's not just IV hydration. So we're looking at other things we can do naturally that maybe it's the food you're eating. Okay, let's suggest some changes. Okay, making sure you have certain balanced diet, physical health. So it's the overall wellness that helps with, I'll say, the naturopathic medicine so that you can stay away from the traditional medicine route. But it's work. And in our community, sometimes the definition of work or just the thought of work can be overwhelming. And then It just exits out, right? But it can be done, but it can take work, discipline, and consistency. Naturopathic, where you can stay away from the traditional medicine route. All of the medicines that I know, it helps one way, but then it harms something else, right? So then there's another problem. And that's the problem with medicine. Okay, we have medicine going to fix this. Oh, but now we have to give you another pill because now you have this because of this medicine. So it just keeps adding on and adding on, but we didn't get to the root of the problem why we had this first medicine in the beginning. So in naturopathic and conventional health, it's just a combination of let's get to the root instead of putting a Band-Aid on, right? And then the gauze on and then the tape on. So I think a lot of people are I want to say stuck in traditional route. They don't know. Just like you didn't know about IV hydration at first and other things we can do. A lot of people in the community don't know about it.
Right.
Or what they can be doing, like some of my clients, and now you're not taking blood pressure medicine anymore. Now you're not taking your diabetic pills anymore, right? And things like that. That's the results that I aim for. And this is why I do what I do. Because I think a lot of I don't want to say generation, but yes, generationals, we're taught to do this and do that. What's your doctor say? Do exactly what the doctor says, right? But we don't look outside of that path to see, no, it has to be something else that I can do personally to help my own health. And that's where naturopathic medicine and natural holistic ways come in to help.
Gotcha. And you mentioned that word. I never heard that before. Is that, you say that one more time? What did you say it was?
Neuropathic.
Neuropathic. What is that?
That's natural medicine. So you look at medicine, and then you have your natural medicine. So naturopathic is the way to, it's a different way of life.
Gotcha.
For naturopathic medicine. It's natural routes, remedies, herbs, IV hydration, things like that.
Gotcha. I appreciate that. Another thing I felt, and I still feel now, like, I know I said earlier how you said seeing in HD, and I just felt so good. But being that this is a mental health platform, right, and this ties beautifully into it, in my opinion, I think what I felt is, and it was so foreign because I haven't felt it in such a long time. And if I did feel it, even the times that I did feel it in the past, I don't think I was cognizant of it because it was my natural state. But I felt what I conceived to be homeostasis.
Oh, yeah.
And I felt like I was thinking better. I felt like it was easy because I meditate a lot, right? Like I have 4 alarms set on my phone, right? And they're gratitude alarms. So each time they go off throughout the day, I stop whatever I'm doing. And I immediately practice peace, unconditional love, and gratitude, because those are internal states that we can cultivate independently of any type of external stimuli.
I like that.
But because I felt like, and I'm a little weird, I'm a little quirky, right? Because I felt like my body had what it needed at the time, I felt like it was easy to achieve that mental state and maintain that. And it was easier to ward off negative thoughts, negative energy, even if it was just someone else that was negative. Like, I'm really not in the space to deal with this right now, right? Or a situation where I may respond, I don't really want to say forcibly, but even though my demeanor, my voice, my disposition makes it seem as if it's forcibly. But even in that state, I was more cognizant of that. Everything was just like tranquil, right? So I wanted to mention that. And then also because you were saying a moment ago, because a portion of mental health is responsibility and accountability, right? So when we were talking about neuropathic approach, and then you said, well, what are we doing, right? Because it's responsibility and accountability, right? So there are choices that we're making that influence our overall health or lack thereof, right? So I want to ask you, because this platform is specifically dedicated to Black men, but all people can glean from it, and especially our sisters too. What are some of the commonalities that you see in terms of deficiencies when you go to administer treatments?
Oh, good question. Lack of thereof. Some of the common dehydration is always the number one. And just the lack of education, and most of my people, they're doing it because someone else told them to do it, right? And then when we get there, I'm like, so what do you look to get accomplished? I don't know. I just know that I want to feel better. Well, what is better to you? I mean, everyone has a different definition of better. What is better to you? Do you want to sleep better? Do you want to have more energy or, mental cognitive? Like, what is better to you? And then with breaking that down, and then I start asking them questions. So how is your diet? How is your sleep habits? Do you exercise? And also, what are you listening to? What are you watching? All of that can hinder your health, and subconsciously you don't know it. So talking with them about that And just education alone can help anyone, you know. Being a nurse, one thing I learned that, yes, it's helping others, it's treating others, but however, it comes within just education because a lot of people don't know. If they know, then maybe they'll change some things around. So we do a lot of education in my sessions. So when I gear on wellness, it's geared for overall wellness. So when we say overall wellness, the 5 stages of wellness, right? Not just our physical. So we have our physical health, have our mental health, our emotional health, spiritual health, and financial health. All 5 of those are the 5 stages of wellness. So we can't focus on just physical. You know, I'm going to the gym, I'm working out, I'm trying to get in shape, I should be better. My blood pressure should be down. That's great. But now you have a high physical wellness. But what about your spiritual, your emotional? Okay. So as we get into more sessions, and it takes work, you know, just like anything else, but really pinpointing what are you lacking? Okay. Maybe it's your spiritual health. Okay. I'm no priest or anything, but however, I think I have a great power, you know, a great relationship with my higher power. And I think that some people don't know how to tap into that. So I'm here to help them with that. Sometimes IV hydration in that HD form can help you tap into that. So with my IV hydration, it's not just, okay, I give you your IV and you'll feel better and leave. No, it's deeper than that because it's really getting to the 5 stages of health. Okay, you need help on your physical health? Let's see. Maybe there's a gym close by. Do you need a personal trainer? Just go out and start walking. That's a start. So it's different stages of the overall health that I like to say that we talk about in our sessions.
Right.
And that helps with the overall body. So it's not just one thing when we're talking about IV hydration. We like to talk about the overall body, what you're dealing with. How do you want to feel? How do you feel now? How do you think your health is now? You know, and I think a lot of people are starting to see that because wellness is starting to be on the rise now. And just tapping into your overall wellness is the key. It's not just one part of wellness.
And I really love that because with holistic health or neuropathic health, specifically with you, you know, as a patient, if you will, I feel like I'm actually included in my wellness journey as opposed to going to the doctor and saying, this is how I feel. And then you're giving me this medicine and then you're sending me on my way. And then I'm still leaving. I still have a whole bunch of questions. But, you know, with this way, again, you know, I feel like I'm included in the process. Like, yeah, you're giving me this, but this is what you need to do. Continue to do that and understand that this is something that you need to continue. It needs to be a constant thing. So I really like that. With men, how many do you treat a lot of men? Good. And I know
That's scary.
I'm sorry?
That's scary.
What's about it? What's scary about it?
They're the biggest clients that hate needles. So I have to treat them like babies.
I told you I wanted to write you up. I was serious.
Yeah. The men are the hardest clients only because, you know, they're tough, but not so tough, right?
But my question was, because I asked you about commonality, like overall commonality, but a lot of us men, like black men, middle-aged men, like are they complaining about feelings being lethargic or just an energy level that they're not getting to or performance? So is that a common theme as well?
Oh, yes. And not just for men, but I've been seeing it on the rise for women too. But particularly just feeling tired, sleep insomnia. You know, everyone seems like their sleep patterns are off, you know, just feeling like you can't focus. There's so much clutter going on that your mental capacity is at a low. So your mental cognitive function is low. So those are some of the things that I've seen, especially in the men community, just trying to boost their energy, the feeling of wanting to get stuff done, but you feel like you can't. And of course, just hydration. You know, they're feeling like I know I don't drink enough water, but I know I should. No, I don't take vitamins, but I know I should. So that's a lot of the things that I hear in my clients that are men particularly.
Gotcha. And I know you mentioned when you gave me my first treatment, because I asked specifically, We all have vices, right? We all, there are things that we like to do. Me personally, I like to smoke cigars, and I do drink Woodford with my cigars. But with regard to consumption or the amount of consumption with this regular treatment, or just being overall health conscious in general, should I limit that to a certain amount on a weekly basis, or how should I attack that, if you will?
Good question. Well, you always should have a limit, right? Not to overdo.
Damn it.
But however, when you are doing the things that you need to do personally, then it's okay. For instance, with the IV hydration, we're detoxifying, right? Just going through the detoxification. So the cigars that you smoked last week, oh, that's fine. That's okay. Just like for women, they feel bad. Oh, I had my cheat day. It's okay. That's why we're doing this, to flush out the toxins and free radicals and replenish with the vitamins and essential nutrients that your body needs. So that cigar that you had, those 2 cigars, it's okay. Now, if you're someone who is not, who's just pushing 5 or 6.
I'm just being honest. I feel like being honest. I have to be transparent.
I was trying to be mild, but okay. Even with your 5 or 6 cigars, it's okay because your body is now optimized with the essential vitamins and nutrients it needs. So those free radicals are being flushed out. So it's okay.
Gotcha.
Mm-hmm. Now, if you're not doing those things, then you're in trouble because you don't have anything to offset or flush those toxins out, and you're constantly smoking or you're drinking alcohol. So you're filling your body with toxins, right? Particularly your liver. So it's things like glutathione. Even if you don't get your IV, every 2 weeks or even every month, you taking things like glutathione or other essential supplements to help flush out the liver, detoxify the liver, then you're kind of offsetting your need of alcohol or cigars or whatever your extracurricular activities are. But you have to do the work. You want to have to pay to play.
Absolutely.
that term.
Absolutely. Mm-hmm. So that's a perfect segue because you mentioned, and I still can't pronounce it, glutathione.
Glutathione.
That's the first time I did it in 2 weeks, I swear. If you can, because you provided us with so much great information, and I sincerely thank you for that. You broke down the cocktails for us, right? Mm-hmm. But if you could just break down some of the essential vitamins, and what they're for and why we need them, because we really don't know.
Of course. So I started glutathione. I didn't know about glutathione until I started doing this. I'm like, this is powerful. Glutathione is the most powerful antioxidant, and we call it the grandfather of antioxidants. It helps to detoxify the liver, cleanse the body from free radicals, and protect our cells from free radicals and toxins. It boosts our immune system, and a lot of the ladies love it. Yes. Y'all welcome. Glutathione helps with the skin. So it gives your skin a natural glow from inside out. And glutathione I get every month myself because most powerful antioxidant. And it helps with the skin as well. And then we have our vitamin C. Vitamin C is major, especially in building immunity, protecting the cells. And it helps with healing as well. Vitamin C is the essential vitamin to go to. So if someone say, what vitamin shall I take on a daily? Vitamin C is definitely one of the ones that I recommend. And then we have magnesium. I love magnesium. All my clients love magnesium because they give you that tranquil, that feeling like I'm calm, I'm relaxed. It's a natural relaxant. I call it my melatonin. It relaxes every muscle in the body. Just think the human body composed of over 600 muscles. So muscles that we know of and a lot that we don't know of. Some are involuntary and some are voluntary. So those muscles relaxing every muscle in our body, that gives you a different feeling that you didn't know that you had, right? And also magnesium helps with memory. It also helps with immunity as well. And then we have our vitamin D. Vitamin D is another essential vitamin that everyone should take daily. It is our natural sunlight vitamin. But however, sometimes we need a little more than absorption through the skin. Vitamin D deficiency is about 80% of our population of vitamin D deficiency. Vitamin D helps with more than bone and teeth health. It helps with immunity. It also helps with healing, and it helps with our immunity and rise of boosting our cells. Okay, it helps to protect some cancer cells as well. That study came out about 2 or 3 years ago. Having vitamin D, high levels of vitamin D, can help protect the cells from cancer. And that's a really big thing in our community. Also, Alzheimer's and dementia. They have studies came out that low levels of vitamin D3, particularly, can lead later on in life to Alzheimer's and dementia. So those vitamins are very important. And one vitamin everybody loves is B12, right? You know, you hear about that all the time. Oh, B12, I need this for my energy. My energy is low. You need some B12, and which B12 does help. It helps to boost energy. But if vitamin D levels are low, your energy may be low because of the vitamin D deficiency. So having low levels of vitamin D can cause fatigue. And some people think, oh, I just need a shot of B12 to boost my energy, or give me some B complex vitamins so I can boost my energy. But maybe we need to boost it with vitamin D. So vitamin B complex combines of vitamin B1, 2, 6, and 9. And it's just it converts our cells into energy with B complex vitamins, as well as helping with neuropathy. So those that deal with neuropathy, B12 and B complex vitamins helps with that. And a lot of people don't know that one vitamin can help with neuropathy. So you don't need gabapentin, right? The doctors will prescribe you gabapentin to help with your neuropathy. You may just need some B12, B complex vitamins to help with that. Zinc. Oh my goodness, I can't forget about zinc. I love zinc.
Shout out to zinc.
Zinc is another major antioxidant. Zinc helps with not only our immunity, but is the major component for healing, wound healing. So those that have underwent surgery, or had some kind of trauma in their body, zinc is the component of healing. So I love zinc, and everyone should take that daily as well. So those are just some of the vitamins that we use on this essential of amino acids that we use. And taurine is really good, especially for that mental cognitive. What I put in your IV, I put some taurine in there. It helps with your mental state. Any other vitamins I'm missing?
One, I was going to ask you as soon as you were done. So you gave me something, I believe it was ALA.
Oh, yes.
Boom, I paid attention.
ALA, that was your second with the inflammation.
That's right.
ALA is alpha lipoic acid, and this is a powerful essential vitamin, acts as an antioxidant. So it helps the cells. It helps with nervous system. It helps with inflammation in the body. It helps to detoxify the body from toxins and protect the cells from free radicals. ALA is on the rise. We just got into ALA, but it's really, really essential for the body, especially if you're someone who deals with anti-inflammatory diseases like rheumatoid arthritis, those that deal with lupus, any autoimmune disorder. ALA is very good for that, especially diabetes, because it helps to break down the carbohydrates into sugars, and so that it can be easily absorbed through the pancreas.
Gotcha. And you mentioned neuropathy. If you would please, for the viewership and for me as well, if you can define that.
Oh, neuropathy is most people that are diabetic, you know how they say, I can't feel my fingers anymore. So it's nerve pain in your fingertips and your toes. So that's what neuropathy is.
Gotcha. Wow. This is a lot of jam-packed information here.
Sorry.
No, we love it. The viewership will certainly appreciate you for it. This is a lot of stuff that I didn't know. Mm-hmm. All right, dumb question for me. Okay, so what is actually in an IV bag?
So for IV hydrations, first we start with normal saline, which is just your sugars and salt fluids, okay? And then in that bag, depending on which cocktail or what vitamins that we add in there, is in the bag. So for instance, I'll go back to the athlete recovery. So you have that salt water, or your water, your saline, combined with the vitamin C, put in their B12, amino acids, and well as some B complex vitamins. So that is the combination of the athlete recovery bag itself.
Gotcha. And sorry if I'm putting you on the spot. Because I know these are natural vitamins, and some people may have the question. So like, how are these vitamins made? How are they compiled?
So with the pharmacy, it's a compounding pharmacy, meaning that with the vitamins, just like in pill form, right? But in liquefied, so that it can be water soluble to go through the vein. So the pharmacy compound these vitamins and nutrients in a form that is a high concentration, of course, because it's coming straight from the pharmacy, and then a water soluble form so that it can be given through the intravenous route. So it's just like if you go to the not GMC, because those are the third parties. Don't go there. But if you get your vitamins orally, so think about that, a pharmacy grade, but just given into a liquid form, so it can be absorbed through the veins.
Gotcha. And I know you said that the effects of each treatment can last anywhere from 7 to 21 days, right? But what is your recommendation? How often should one undergo this type of treatment?
Well, good question. So everyone's different. Those who are extreme, that works out a lot, or athletes, twice a month, typically every 2 weeks. But if you're someone who fairly doing what they need to do to stay healthy or to get healthy, once a month. So everyone is different. I have some that get it once a week, twice a month, and then once a month. And if you're someone who want to stretch it out, once a quarter. So everyone is different. I recommend at least once a month.
Gotcha. And just so that people may know, what are some of your prices or the prices that are associated with each respective treatment?
It depends on the cocktail, but prices typically start at $150 and up. Of course, the more you put in the bag, then the higher the price will be, or it depends on which vitamin or mineral that we use in the bag. So the prices can start at $150 and up for a cocktail.
Gotcha. And immediately, we may hear that and we may think, okay, well, 150 and up is a little bit too much. I don't want to, invest that type of money. But when we really step back and take an expansive approach and realize, what do we actually spend our money on versus actually investing in our own health, wellness, and vitality? From personal experience now, I can honestly say that, listen, this is 100% worth it. And this is definitely something that you should consider and add to your repertoire, your arsenal, whatever. Queen, did I miss anything that you'd like to add to this? Please feel free, anything.
Can't think. I think we went over a lot of information. But I just want everyone to know that the wellness journey starts with you. Okay? This is a decision you have to make. No one can make it for you. But once you decide to make this decision, then you won't regret it. I've been, like I said, doing this for over 20 years now. My life, just how I feel and the feeling I get from others and the results I get from others did not change until I started when I switched from medical to wellness side. So from medical to wellness is when my life changed. And I know yours will too, but it takes work. And if you're willing to do the work, your life will change drastically. And not just talking about the physical health, right? Internal health, as we talk about the 5 stages of wellness. Start trying to incorporate that in your everyday and just be conscious of knowing that you need to have a balance of all 5. Once you have that balance of all 5, oh gosh, you're electrified, right? You will feel a difference in your body. Your frequency will rise. And it can start with IV hydration. That's the start of wellness for a lot of people. They don't know where to start. You might need a detox. And there's a detoxification IV as well, where you may just need to detox from a lot of stuff. And people think it's physical. With my sessions, it's more than physical.
Yes.
It's on a whole nother level. So I'm not just pushing IV hydration, but overall wellness. So once you get that detox, and then now it's up to you what you put in. Okay, now I just flushed you out, so it's up to you. What do you put in? What do you want to feed your body? What are you watching? What are you listening to? What are you eating? All of that is very important with this journey, and I wish more people would get on it. I hope after seeing this, more people will want to get on it.
Absolutely.
And just ask around, educate yourself about the benefits of just essential vitamins and nutrients. Essential vitamins and nutrients. A lot of the problems with health, I'll say, with cardiovascular health, with diabetes, a lot of that we say, oh, it's hereditary, right? But recently, studies have came out and said, no, sometimes you have high blood pressure because you have a deficiency in a vitamin.
Absolutely.
So just think if you're optimized with your nutrients and your essential vitamins and minerals, how that can help you in the long run as far as your overall health.
Gotcha.
So just letting the viewers know, increasing your health, one step at a time. I'm not telling you to leave your doctors or anything. Please don't say, Queen said. No, but taking this step yourself to educate yourself. Okay, what does this wellness route consist of? What can I do to help myself? Whether if you are dealing with a chronic illness or disease, you can still come out of it, and not the medicine way, okay, in the naturopathic way. So that's all.
Queen, this was amazing. I appreciate all the information that you
you.
blessed us with today, and hopefully some of the viewership will be able to take that and actually apply it. Remember, this is practical application. It only works if you put it to work. So, Queen, I really appreciate you coming today.
Having me.
Is there
Thank
anything
you.
you'd like to shout out? We're going to put all of your information on there, but if you just want to shout it out, websites, how to reach you, please.
Oh, yes. So Nurse Queen Lang Y. I am on IG as at the THA Drip Nurse, and also go to the website. We're at www.refreshedivt.com, and our phone number is on the website as well as the email. You can reach out anytime. Myself or the team will get back with you as quickly as possible. Don't think any question is a dumb question. We're here to help you in your next step in your wellness journey. So thank everyone. Thank you for having me. I
You
really
bet.
appreciate you.
Sidebar, Drip Nurse, hottest IG name. Listen, reach out to Queen, optimize your health. You won't regret it.
No.
Listen, if you found value here, and it's my sincere hope that you did, then please comment, like, subscribe. Follow the You versus You podcast on YouTube, Facebook, Instagram, and TikTok. And keep checking me out, and we'll keep busting this thing down. Peace.
It's you versus you. Time to clear your mental, everything you've been through. Looking in the mirror like you're the one with the issues. You against yourself, feel like you against the world. Internally battling.